Hi, I'm Dr. Barber Chicago. I'm a medical certified hair loss practitioner. I'm a medical esthetician, and I am a medically accredited infectious control service provider. What I like to do is give you just a little bit of information on how I plan to open my business after the quarantine is over. I'm in Chicago, Illinois. We have a number of cases, so we want to open with safeguarding ourselves and our clients. So I will give you a few tips, a few resources on how I will be conducting my business, having a safe, healthy, and controlled atmosphere. As we know, we have been plagued with the coronavirus, COVID-19. It has taken a toll on mostly everybody. As it stands in our state, we have just been extended. We will not be able to go about our daily lives and back to work until May 30th, essentially till June. So at this time, I just want to share a little information on tips, resources, things that will come into our new normal of how we will operate our business and how we can expound on these things. We will have to take precautions using proper PPE and a number of things that we are going to discuss. Infectious control. It is the set of standards and principles that are used to stop the mode of transmission when it comes to infection. So we're talking about microorganisms, pathogens that are like bacteria, viruses, fungi, those things that usually start an infection and can cause disease. So there are modes of transmission which go by a chain. If you can break that chain, then you stop the infection. So this is prevention along with infectious control. So why is it important? Because we deal with plenty of microorganisms, small pathogens from viruses, bacteria, fungi, even parasites that we deal with on a daily basis that we do not see. So you have clients or patients that come into your facility often, and we want to make sure that these items do not get passed along, these microbes do not get passed along from client to client, patient to patient, so we do not have cross-contamination. It's very important. So we're going to go through a few of those things to find out how do we stop the chain of reaction, the chain of transmission. So let's talk about how we get into that. I'm going to also give you a little information on my step-to-step process of how I do plan to work in between clients. Depending on the time, what I do also plan to do is put myself enough time in between each client to be able to clean, disinfect, and even set some of those implements that I'm using, depending on that service that I'm doing, into a sterilizer at that point so that I can prepare myself for the next client. All of the things that a client may touch, surfaces that a client may touch, which may be from the door handle to the chairs to if you have local items that they reach at, even purchasing items as far as products that are on your shelves. You want to pay attention to your clients as much as possible. Just really be kind of persistent in cleaning. Always using and having on hand your disinfectant. Hand sanitizer is a must. Clinical grade hand sanitizer that's antimicrobial is definitely what I'll be using. I'll also have that for sale, so I won't have it available right now, but I will shortly, so check back and you can always go to drbarberchicago.com and see some of those items that I will have. So we definitely want to make sure that the clients have tissue, hand sanitizer, soap, and water available. So if they sneeze, if they cough, if they need to do something where they have exposed their hands to any type of microorganisms, we want them to be able to clean that off. As I said before, from once a client enters, because my situation is a little bit different than an open wide shop, I have a more controlled environment. So from client to client, I will definitely clean. So as my clients wait, I will definitely be taking care of those things that will give them safety and health. So for all protocols, they start off with a standard. Our hygienic standard will definitely start off with what many people have been speaking about, and we're hearing it time and time over again. It will start with hand washing. Hand washing is detrimental to how we deal with transferring something from a surface to ourselves. Because we touch our face, because our hands touch so many different surfaces, we definitely want to make sure we do proper hand washing. There are plenty of videos here on YouTube and as well as other platforms of showing the proper way of hand washing. I'll be going a little bit further with some of my protocols depending on the services that I'm providing. I'll be doing surgical or clinical scrubs, getting in between the fingernails very well. You can also do this with a fingernail brush. This will also move dirt and debris in between your fingers as well. So depending on the services that I provide, if I'm going to be dealing with pustules, blood-borne pathogens, anything that will be body fluid, mucous membranes, I will definitely be going a little bit further and doing a clinical scrub. Second is that we definitely want to speak a little bit about our cleaning process. There are 3 levels of cleaning. You have cleaning, disinfecting, and sterilizing. Sterilizing being the most effective and usually is not done in a setting where you have a barber shop or a spa or a hair salon. We would be doing mostly cleaning and disinfecting. Disinfecting does kill up to 99.9% of the germs. Sterilizing cleans 100% of the germs. Me personally, I will be sterilizing my implements that I do extractions and different procedures with when I'm doing services for colloidal nuchae and pseudofolliculitis barbae. Those implements will definitely be sterilized. For a little bit more information about those 3 levels of cleaning, check below, the links below. So PPE is another term that we're hearing a lot lately. It is personal protective equipment. And so we're talking about gloves, which we will be using, I've used for several years and will continue to use for several reasons. We're talking about masks, face shields, even head garments that will cover anything that will be exposed. If you're even going further into wearing smocks or capes or even disposable gowns that you will be getting rid of, depending on if you're an esthetician or doing some further procedures outside of cutting hair or doing hair. This is PPE. How to properly use PPE. Gloves are to be used. You should wash your hands prior to using the gloves and also exiting the gloves. Gloves should be put on in a proper way when disposed of in a proper way. They should come all the way down to below the wrist as far as that band will take it. If you have on a watch or any type of wrist jewelry, you would like that to cover that because you don't want that to get contaminants in it as well. Microorganisms are very small. They can travel anywhere. So we're going to talk a little bit about the mode of transmission, which can be airborne. This is why PPE is very important, especially for us to wear, because doing a client and you're doing a facial is going to be very hard to do social distancing. So we'll discuss exactly what are those modes of transmission, how to clean off certain surfaces, and I'll even have a resource guide of different types of disinfectants, cleansers that you'll be able to use, purchase, because they're very hard to find right now. You also want to make sure that you have your hazmat containers ready for when you have sharps. So if you're doing a razor, using a razor for a razor shave or a lining, or if you're using scalpels when you're doing microdermabrasion, not microdermabrasion, I'm sorry, for dermaplaning, for those estheticians that do those services. Make sure that you have your hazmat containers available because those sharps need to be disposed of properly. Also, your gloves or anything that has any type of material on it that came from your client, you want to dispose of it properly. If there's blood in it, you want to double bag that and wrap it up so that it does not get exposed. Treat everything that you come across with as though it may be contagious, and you'll stay ahead of the game. It may take us time to get used to our regular or our new regular, which was the new standard of how we move into business, and just keep being consistent. See, once you're consistent with something, that forms a habit, and then it won't be something that you'll think very heavy about. Your clients will definitely appreciate it. They will depend on it. You will definitely benefit from it. I can even tell you that it is going to be very marketable to show how clean that you keep your space. And cleanliness has to be on the top. High hygienic standards, and definitely staying ahead of the game as far as when it comes to infectious control will definitely keep you separate from just your average barbers, cosmetologists, estheticians, or any type of service provider that you are. Also, we deal with areas that are very intimate and where you can receive the infection at. So points of entry. So we're dealing around your eyes, we're dealing around the nose, we're dealing around the mouth. So when we're doing beard washes or facials or even a lining, you are very close to these points. So you also want to pay very close attention. Anytime you come across anything, clean that area with the proper materials, dispose of it. It's best to use disposable items that you don't have to worry about cleaning. Those items that do need to be cleaned, they have to soak. They have to go through the proper procedures that's on the back. Your EPA verified and certified cleansers will tell you exactly what you want to do. Contact time for that product on that item is very important. All of that information I'm going to give you. If you want to definitely pay attention to the next video that I'm going to give. I have a number of tips, resources, guides. I'm giving away a lot of information. I just want everybody to be successful in returning back to work. The post-pandemic era is going to be major for us. We can really set ourselves apart from just being average service providers by putting these things into place. All right. Thank you. Anybody that enjoyed this, please like and subscribe. I have a lot more information that I like to share, and I also will have some classes. So please stay tuned. All right. Everybody stay safe and quarantine, with your families.